Binaka, just have a question. I have a friend, a patient. He's just being sent back from the Middle East. He's in the army. He's supposed to be here this evening, but he was sent back because half of his heart, they said that it collapsed. They sent him back. He's in Fiji now, and we're hoping. I'm waiting for him to come. So I think I'll start off the question: is there any kind of help that can help him? He has changed his diet and taking in some cayenne pepper with water every day. He said that there's a dramatic change that has been seen from the doctors. My question is there any other, what can you call it, help that can help this brother of mine just to help up with his heart condition? He was in the camp, then they rushed him to the hospital. It is a 1-hour drive, and when he reached there, he was unconscious, and they put all these, and he woke up, he was all right, and they said half of his heart it nearly collapsed. So I'm just asking if there's any, just to improve his condition. He said he will bring all his medical records tonight, so I'm just want to start off. What can be done just to help with his condition?
Well, there is definitely some hope there, but the main thing is he must understand his limitations. That when a person have half of their heart, one of their lungs is functioning, or one of their kidneys malfunctioning, then they must take that under serious account. Now, as for trying to rebuild the heart that is non-functioning, that may not happen. But the body has a remarkable ability to compensate. There's a system called angiogenesis. Angiogenesis is where the body will grow new blood vessels and eventually tissue. It would rebuild itself through angiogenesis. And that's what the new technique in medicine now is, exploring the possibilities of angiogenesis. Instead of surgery with a bypass, that the body will give itself a bypass. It's very similar to stem cell, but it's a natural process of the body growing blood vessels to encourage growth. Now, that can have a negative effect, and that can have a positive effect. We know that cancer uses angiogenesis to grow tumor cells, but we also know that through phytochemicals that we can hinder and prevent angiogenesis. So I want you to understand, yes, there is a way that the body will compensate in some cases. Now, the best thing that I can think of that he can do naturally is to make him a very strong hawthorn berry extract. Hawthorn berries have the ability to reduce congested heart failure, along with some very strong natural diuretics that can help pull any fluid that may be building up in the muscles, especially if the muscles are working so hard. It can build up condensation and fluid, and that's where you get congested heart failure. But one side of the heart is working to compensate for the other side. Overwork the muscles, you develop congested heart failure. So he's got to be mindful of that. Don't overexert themselves. Make sure he takes some diuretics to try to flush some of that fluid off, and get some hawthorn berries, and then just pray that if he monitors himself, he could probably live a normal life like that. and try to find out what caused the other side of the heart to fail. Because if he don't know what caused that, then it could cause the good heart side to fail. So he needs to make some profound lifestyle changes, and maybe Margret or them would like to respond to some of that. Okay.
I would.
Ningan raba me translate takana kaya madal takaya Mammon Wilson. Okay. Nakisia vima mani nono uto collapse, so it must be a heart failure. Madal takaya brother Mammon ni ena tiko na nui biko na turangango kebaka ena takabo ko enda na bingarabi koya ena buki na yango membulia wo na salanindra na dana angiogenesis. Angiogenesis means the helping the body to make new blood vessels. Nangona ilanga kinumuto kema bala rere ndona salanindra ko bakanya na uto tata songo mai. Keba kasa block indona salanindra dabi ko nangandra modakaba. You can nangandra modakaba indona natural bypass bakana nandi back road senamba back road. Me bypass takana blockaja. Na dana angiogenesis. Now my question is, what are the things that we can do to help with angiogenesis? What I understand is exercise helps with angiogenesis, or what's called collateral circulation.
Well, you know, I am totally fascinated with angiogenesis and anti-angiogenesis because the medical system is just now tapping into those resources. Eventually, they would be able to forget about surgery because the body can do its own surgery. And just like you grow fingernails, and you grow your tissue, you get cut. Matter of fact, I'll just back up. The way they discovered angiogenesis was in a surgical operation room. They found that when they performed surgery, that a lot of the scar tissues and a lot of the cancer would grow back real fast. And they found that it was growing new abnormal blood vessels. And so they began to look into that to see what's causing these blood vessels to grow. And so what we're doing now is how can we control angiogenesis? The most powerful thing that we have naturally that can do it is blueberries, blackberries, all your berries are very powerful anti-angiogenesis substance, especially if you can get these berries in the powder form. And we make our own natural angiogenesis herbal chemo made out of natural organic berry powder. And that's to me, and some of the herbs, turmeric is a good one. The Pacific yew tree is another very good herb to stimulate angiogenesis. And so selecting the right herbs, getting the right exercise, reducing the amount of free radicals in the system, encouraging good circulation, then you can actually help the body heal itself.
Okay, now angiogenesis, yeah. Angio means blood vessel. Genesis means new, creation, like Genesis, the first book in the Bible, talking about creation. So that's angiogenesis. Bamadala takachigo koya, ni sa block in dona salnindra koya bakanetigo na uto koya na sana koya collapse. Iko mona sulewa sona ka koya na buke a membulibo na salnindra. Meba kana turmeric. Lebu weekend ngo na dango kari. Turmeric. Niko na ngundu dango kari baga lebu concentrated ya na buke na angiogenesis. Blackberry, blueberries, we have that available, but in frozen forms. They sell it in the supermarket. Maybe you can give him in some form of smoothie where you blend that and give that to him. do talangana ka baga madal ta ko na natural diuretics yana ka ke ka sa fail no muto natural diuretics ke ka fail no muto ke ba sa sini pam ta ko bina ko nandra ke bale there'll always be some backlog of fluid in your lungs and ababu na medengula ka ko ya. There'll be backlog of fluid wana lower limbs and ababu na mebubu de na ngwana and abuku ni failure ya and ababu na mena sonongo na mena lakanoni dengu bude na ngwana yuko na ngandra ba mona ni matali wina waya ko esa wakabu na tu na congestion na ngwana yuko na ngandra ba mona sulebo ay sona kana mebuke mena susua wakabinaka kina mebakana daba conceal mebakana cucumber juice. I'm just telling them some things that will help. Strong diuretic. Celery juice, cucumber juice. For us here, I've seen mbu juice is a very good diuretic. The green coconut juice. Dabatale. Strong diuretic, monosulewa, cucumber, celery, or mbu juice to help him relieve himself of those excessive fluid and maroretu. Garo ni ko mekaku ni over exit ya mekaku ni pako dai ko ya kep kasa kilangan na ngon ni rani tomba le tangai bidana kalau maroro ya na no ni vengo kep ka na push taki ko na rani shortness of breath rani baka puna talento na matini uto. Okay, do tal na taro I'm asking a question. There is a condition that is very common amongst us, and this is a condition that would always cause the highest sale of medication regarding this illness, and that's gastritis. Could you help us and share with us some things that will help relieve gastritis?
Okay. I sure will. You have really the perfect plant fruit here to deal with gastritis, and it's the papaya. Now in the States, we use papaya enzymes, papaya tablets. They're not nearly as strong as semi-green papaya. In the semi-green papaya, there is a substance called latex in it. It's that milky looking fluid in the semi-green papaya. It's very high in latex. If you take about just a small chunk of it and just chew it and swallow the juice and then, throw out the fiber and the roughage, but just swallow the juice, it will neutralize the acid in the stomach. Now I'm gonna let Margret she can talk about stress in this relationship and diet, but just a few other things is charcoal too charcoal has a carbon action, especially activated charcoal. Over here with a lot of coconut, you can make your own charcoal, activated charcoal out of coconut, which is some of the best charcoal in the world. And that can absorb a lot of the acid out of the stomach. And like I said, Margaret, you may want to comment on some food and some other stress-related things.
Yeah, well, also with your diet has a lot to do with it. Sometimes eating and drinking with your meals can cause it also. And you can, stress, as he was saying, stress can also cause it. You can go on a detox program and, just watch what you eat most of the time. Don't eat too many gas-forming foods that has acid and stuff in it. Mainly, that's what causes a lot of gas and stuff.
One other thing is your probiotics. A lot of times you can get bacteria, a virus in your gastric tract or your stomach. So the probiotics are really good. but you really need to get a really strong probiotic. Now you can get probiotics 50 billion, 100 billion. We use 400 billion bacilli count, which is extremely high count. Anytime we deal with gastritis, any type of stomach problem, H. pylori, we give them 400 billion probiotics. And we also give them cranberry juice, and we make a tea out of peach leaves. You can make it out of your leaves, out of your papaya leaves, to get the same kind of quinine. The quinine is in the leaves, and it too can discourage any type of H. pylori bacteria that may be forming. Garlic would also be useful for reducing H. pylori buildup of acid in the system.
And we also give them digestive enzymes like HCl and pancreatic enzymes and stuff like that.
What natural pancreatic enzymes do we have that we could make here in Fiji?
You probably, the strongest digestive enzyme you're going to have here would be from the papaya.
Okay.
I mean, that's what they use to make meat tenderizers and everything. It's going to be the strongest. The main thing with any type of digestional problem is dealing with stress. Eating and being under stress will do more to pump more acid into the system. Chewing gum can also encourage too much acid buildup. So these things, easy thing you can do to eliminate excess amount of stress built up in the system.
Dona mate ana gastritis da wala kani bi matabu balenga se nanda bi korkoro nanda bi balenda kadaka to vira tu na gastritis na gastric koro tu kunutu kama mena lomandra ramode tu rabukin dar kona kata na lomandra bagamadal takachka brother Mammon bateke sister Margret dona ka kendara ni bakayanga takaiviti me bukea me kakuni da gastric ya na kena bakayanga taki na welechi ko sember sarnindreu semi green da chikida nga dona chikina ya mendangai mama na sap bula chukika tiku kina dona weni mate na latex ko na bukea me na libaka mabotaka na buno ko kama ko rara tiku ya do tal na ka endara ni bakayanga taka na charcoal activated charcoal and a book in gastritis. Dona ka rowasia na cranberry juice. Cranberry juice round in the bulia na supermarket baka na grape juice. Merangunuba me bukia na healing. Do talanga na ka ko indo bagabun na gastritis. E vida na ka ni bagabun na gastritis. Do na stress lamoda. Karua na warau ni kana ke bakar do mamandrenga tunga. Sena kana ngunu. Sena kana merdalata tu na ngoni kana dona kale bubir na gastric na dundru bella tendo na nave ko connecta kana mona bateke na stomach na dana na vagus nerve na ngona nga rarau kino ko na mona e bakabuna na stomach me produce ta ko lebu na hydrochloric acid quando bakabuna na kama ena dabu imbudo Keba kao yuko mona buke ento ko to gastric yuko mona address taka na tobo ni nana baka sama. Ya ndo na weni mateleu. Mona kiriko e meka ko ni lomoda se mendo reda na ya sanadani vitala noa se meka ko ni torutu ka kututu bateke ko e ndo na rarawa ko sa dendema ye semberangani o sotakina endua se me kerebe bo sotikina. Ndo na kambimbia na digestive dona wa bacteria quando vakabuna na gastritis ko associate ki na gastritis ko ba madala takchiko brother Mammon na dana na H. pylori na H. pylori dona bacteria nangona e kunikina e na lomanikete e tiko na kena test o ko endo vakabuna me rauni le to weekend kina na stomach cancer na bacteria ya ko ndo wakabuna na gastritis o ko rani buke wana popo leaf tea. So do we boil popo leaves?
Yes.
Yeah. Rani wakamate na popo leaf tea. Na popo leaf tea nga ko ndo sulebe na to bidengi. Wakamate talanga na H. pylori. Ko rani wakamate ko rani wakabuna na stomach cancer. Do talanga na kanda rani wakayanga na garlic. Is it raw or cooked garlic?
It's raw.
Raw garlic. Kena digestive enzymes. Na digestive enzymes o ira na enzymes na weni mate kwe vivu kena break down taki na kakana. Enzymes bakana papain kwe vamadala takichiga vana welechi. Bromelain. Bromelain kwe tigo vana pineapple. What's another?
Grapefruit.
Grapefruit.
Yes, it's high in bromelain also.
Grapefruit.
Pineapples.
Pineapples are high in bromelain. Ya nakabika rani wakayanga taka ko endo eto bi gastritis chiko mebuke me mabo na non gastritis. Total naka o read ni rani buke. There's a herb that we have here that if you have a cut and it's bleeding, we can use this herb to stop the bleeding. And it's also very effective in gastritis. Ya na wambo sudu. It's called in English mile a minute here.
Okay.
They, what they do is they take a few leaves and they blend it with a bit of water and they drink it, and it usually soothes and heals gastritis. There's another one that I find that is also helpful is aloe vera gel.
Yes.
The inner gel of aloe vera is very soothing in gastritis. Thank you. Dua tali na taro?
Minaka eu to eu chicken tana matina eu bubu chinga me la ko chicken wani udungu yo sin witala chinga aktal chinga na wani matango kerani ko tukuna mendo na keni wali.
She's got an illness where she's coughing and she's got running nose and she seems to have like a viral, like a flu-like illness. She's asking, what could she do to help her illness?
I mean, there's a number of things could cause that. You know, she could be having an allergic reaction to something. You know, it could be a virus. I really don't know what's causing that or how regular she's having that. I'm assuming that it's a viral problem. But it could simply be that, you know, it could be odors, it could be perfume, it could be a lot of things can stimulate your immune system to react to that. Coughing, your nose running, sneezing is a curative reaction. It means your body is responding, trying to clean something out. That don't necessarily mean that it's a bad thing. It's really a good thing. It's just that your immune system got to be strong enough to get you through that crisis. If you was not coughing and sneezing and did not have a fever, I would be more concerned. As long as you got a fever, I would be encouraged that your body has found a healing crisis. But you just got to be strong enough to get through the crisis. Now, what can we do for a severe cough? Sister Mark, what would you do for a severe cough?
Well, I would get some, boil some honey, and I would put some cayenne in it, and some lemon juice, and I would give it to her, and that would help with the cough. But we make up a lung tonic with horseradish, garlic, onions, turnips,
Peppermint?
Yeah, peppermint and the crystal, menthol crystals. And we blend all of that up and we give it to you. And it'll bring up everything out of you. But I know she was trying to tell me that the fan is causing, you know, it's triggering that too, right, you know. So I would do that, but I would mainly do a good cleanser. First of all, I would do a cleanser, and then I would give you the lung tonic, and then I would do a steam treatment on you. I don't know if y'all have horseradish over here or not.
We do have radish.
It's horseradish.
I'm not sure if
It's
that's
really-
horseradish. It's very bitter and hot.
Yes.
It looks like a carrot, but it's color
That's
white.
horseradish.
That's
Okay.
it.
We do
Yeah.
have horseradish.
That's a very effective
Yeah.
lung tonic to bring mucus and everything out.
If you take the horseradish and mix it in lemon juice, it will pull the mucus out of your body. It's just a run right out. So it is very powerful for expelling that mucus out of the system. And Margaret told you right. You need some steam baths, some sweat treatments to open up that mucus, bring it out, along with a lung tonic. Take a little extra vitamin C and, and just see how well it worked for you. But if this type of condition is happening on a regular basis, then I think you need to focus on boosting up your immune system, because it may be an allergic reaction to something.
Okay, set.
And another thing, if you're feeling stuffed up here, there's a way that you can take your fingers and come down as hard as you can, and that'll release it. And then you want to take 2 fingers and come down this way a few times, and that'll release the pressure, and your nose will run that way also.
And if you have a total blockage of the sinus, sometimes you can have polyps or scar tissue in the sinus cavity. And it can have a total blockage where you can get a lot of inflammation. The only thing that I know that would unblock a sinus and would unblock it in less than 5 seconds is that you take 1 drop of DMSO, 1 drop of peppermint, and drop that in your nose. And before you can count to 3, your sinus will be wide open. Totally unblock it. 1 drop of DMSO, that's the liquid, 1 drop of peppermint, put that in your nose, and before you count to 3, your sinus will be open, the blockage will be gone. We do it all the time. Sometimes we just can rub it on the side of the nose and open up the sinus. Another good thing is the menthol crystals. I brought some menthol crystals because I want you all to experience it. If you never experienced menthol crystals, you're in for a treat. I could put a tablespoon of menthol crystals in a quart of water, put it in a pot of hot boiling water, it would vaporize your whole house. Even with the doors closed, it would go in and evaporate the house upstairs and downstairs. And you'll breathe just as free. People that's on a sleeping machine, we give them this treatment and no problem. Asthma, sleep apnea, put that menthol crystal and you see what will happen. I brought some. If you want to try it, you'll be amazed how powerful that menthol will work.
And I have a little DMSO.
Okay.
When was it that you last came and we went to Nadila? Was that 2000
Yes, it was around that time.
2006 or? Well, it was a number of years ago. Mammon had come, and I had learned how to clear the sinus instantly using hydrotherapy. I watched his DVDs, and I'm going to share that with you because that is what I successfully use in my clinic to instantly clear sinus infections. Sinus infections, you would know, there's a sinus infection if there's a severe headache with a blocked nose, or if there's just running nose and there's a lot of sneezing. What you do to clear the sinuses, what are sinuses? Sinuses are air cavities that are in your forehead, in the skull, behind the eyes and on the cheekbones. They're just filled with air. But when there is a sinus infection, the virus that you have in your throat could go up and congest it with mucus, and that's when you have a build-up pressure and you would have a headache. So what they were trying to explain is things that you would do to clear it. Now, we may not have DMSO. I know it's hard to get it here. What you could do is over the sinuses, take a hot face towel and compress it over the sinuses for a few minutes. Put it over the sinuses, above the nose this way for a few minutes. Sometimes I would use Epsom salt in my hot basin of water because Epsom salt has magnesium, which is a muscle relaxant. It would relax the muscles over the sinuses. After you do hot compresses, I would only do this in the clinic, not ask the patient to go and do it at home, is take like a half a teaspoon of saline water, which is like a cup of water with a teaspoon of salt. You'd mix it and you put half a teaspoon of that in the nose, and they would get up and they would blow out, and it would have such an osmotic effect of drawing out mucus. I would do that about 3 times, but you don't have to do that at home. The next thing that I learned from Brother Mammon's treatment is do the heat compresses and then just steam your face. And then that would help open up the sinuses and clear it out. What we have in Fiji is what I use, it's called white flower oil. We don't have peppermint oil. It's hard to get menthol crystals. And peppermint oil is very expensive, but there's an oil out there that's got 5 oils. It's got wintergreen, camphor, menthol, eucalyptus, and another oil that's a mixture of those 5 oils, and it's about $3 a bottle. It's called white flower oil. You would take 2 drops and put it in a hot steaming basin and just steam your face. So you'd compress your face over the sinus area and you steam your face, but you would do it in the morning. That would clear the sinus instantly. Sometimes it's almost like magic. You'd clear it instantly, but it would fill up over the day. You would need to do it again in the evening. And then you would take a lot of vitamin C to help boost up your immune system. So you might want to do that for 2 or 3 days.
Another remedy I got from Dr. Mammon is with the sinuses, is what cured mine. They were real bad. It was where we had to boil some Epsom salt and put a little clove oil in it and let it cool, and I rubbed it all on my face and my neck, and I slept with it. And the next morning, I didn't have any more sinus. I haven't had any bad sinuses since.
Praise God. Since I've used Brother Mammon's, I've altered it a bit, sorry, Brother Mammon, to suit the Fijian situation. Since I've used the sinus treatment in my patients, patients who would have sinus infections almost every month, and they would come to the doctors for antibiotic after antibiotic after antibiotic. Once you would do that treatment, you wouldn't see them for more than a year, and they say, I'm so sorry, Dr. Loata, I haven't come to see you because my sinus has improved. So I praise God for that treatment, Brother Mammon.
I want to share a treatment with you, and this is just for educational purpose only. And I'm not encouraging anyone to try this treatment. But I just want you to know the possibilities. There are possibilities in natural medicine that could compete with any type of allopathic treatment. And so I'm just sharing it just for information. I'm not encouraging no one to go try it. If you have scar tissue and polyps in your sinus cavity, up in your nose, you can take an herb called bloodroot and grind it up to a fine powder, put it in a paper bag, and sniff it up. Sniff up the powder, and the bloodroot would eat the polyps and the scar tissue out of your nose. And sometimes that can cause a blockage. Like I said, I'm just sharing to you for educational purpose. There are things that you can do in herbal medicine that will rival or compete with any allopathic treatment.
Good evening, panel. Can you all address gallbladder problems, pancreas problems, pancreatic problems? What causes gallstones?
Well, the big problem is, the diet, eating a lot of fats. We know that the purpose of the gallbladder is to secrete bile, the B-I-L-E, bile, to emulsify fat. That is to break fat down to fatty acids. And if you're consuming so much fat on a regular basis, you can overwork the gallbladder. And this overworking it can make it produce too much bile. And sometimes the bile can mix with calcium and make calcium stones, or what we call gallstones. And these gallstones can be a problem because they can get embedded in the gallbladder duct and can cause the bowel to bag up. You develop yellow jaundice or some other severe pain. What we do is simply put a person on a gallbladder liver flush. And I'll let Margret comment on the liver flush or the gallbladder program.
Well, it's usually the liver and gallbladder together.
Yes.
We'll do a 3-day liver gallbladder cleanse. On the first day, we would take 1 ounce of olive oil and 5 lemons. And we would have them take that early in the next morning, and it'd be about 2 or 3 hours before they eat breakfast. On the second day, we'll take 10 lemons and 1 ounce of olive oil, and we'll go through the same process. And in between there, to drink plenty of water and apple juice. And on the third day, you would take 15 lemons and 1 ounce of olive oil, and lay on your right side so the oil can, they won't get upset with the oil and the lemon juice. And then we have them do that, and then later on we'll give them a colonic.
Or a coffee enema.
Or a coffee enema.
And the coffee have a small amount of caffeine that stimulate the gallbladder to release the bag up bile. We use coffee enemas to control pain. When a patient is in severe pain, a lot of the pain is stimulated from a bag up of bile in the bloodstream, which overexcites the nervous system. And when it overexcites the nervous system, it can increase the pain. So by calming down the nervous system, we're able to reduce the pain by giving them coffee enemas. Sometimes we do coffee enemas up to 3 or 4 times a day. And I've worked with patients on codeine and morphine, and it couldn't even control the pain. But when I gave them coffee enemas, I was able to, control the pain. So the coffee enema will help in relieving the bowel. I think that a lot of problems working with people like yellow jaundice, nausea, is bowel. A lot of time that bowel upchuck comes up from the gallbladder duct, go up through the duodenum, the first section of the small intestines, and will filter back into the stomach. Now, many people, you have, kind of had stuff to come back up in your stomach, and it burn, and you feel like you got to throw up. Sometimes the bowel can do that. And when that happens, it takes your appetite, and you don't want to eat. And so by simply giving the coffee enemas, we're able to pull that bowel down, back through the intestines, down to the colon, and out of the body, instead of letting it filter in the skin, giving you yellow jaundice, or coming up in the stomach, robbing the appetite. Most of the cancer patients I work with, I know right off that the cancer do not take your appetite. It don't do that. The biggest thief of appetite is bile and toxin. Anytime I work with a patient, don't have appetite, I clean them out, and their appetite gonna pick up. So with that gallbladder flush, we also take a hot castor oil pack and apply a hot castor oil pack over the top of the liver. Most people do not know how to apply a castor oil pack. And it's well documented. Castor oil packs can help break down small tumors and cysts. It can also shrink fibroids. It can do a lot of wonderful things, but you have to know how to properly give a castor oil pack. And most people get a little thin piece of cloth, wet it with a little castor oil. That is not going to work. It needs to be thick, and it needs to be saturated with nice warm castor oil, and you must apply it to the area and wrap it real good so that it penetrates deep down in the body, and that's when you really see the effects of how wonderful castor oil packs can work.
I saw that castor oil pack used with tissue. Individual using with just paper towel. That's wrong?
That's wrong. Now, get something as thick as a baby's diaper, towel. It needs to be thick, a cotton cloth, make it thick so that it's saturated with castor oil and warm castor oil. But a paper towel, no, that won't work. And you had mentioned something about the pancreas. Pancreatitis, be very careful with it because it's infective. You know, you can get infected messing with that. But the way we work with, and I work with a lot of pancreatic cancer, a lot. That's one of the main problems, brain cancer, pancreatic cancer. We have gotten a lot of that this year. The simplest thing I can tell you to do, I could tell you some things to do, but it's not available to you here. So I'm going to try to tell you some of the things that you can use here that is quite effective in dealing with pancreatic or pancreatitis. It's turmeric and coconut oil. You mix turmeric and coconut oil together, and you need a small amount of black pepper. We don't use black pepper, we use pepperin. Pepperin is an extract out of black pepper, but you will not get the benefit of turmeric without fat and without black pepper. Black pepper helps your body assimilate the turmeric. Even though a lot of people take turmeric, you're not getting the full effect out of it. You need a fat and you need the black pepper to help it assimilate better. So if I was going to give somebody with pancreatic cancer, I would definitely give them 1 pod turmeric and 2 to 3 pods coconut oil and 1/3 of a pod of pepperin or black pepper. And I would give them maybe a tablespoon of that 3 times a day, and that would help them a lot.
Is pancreatic cancer hard to detect? What are the symptoms? Early detection of pancreatic cancer?
Well, I mean, this is where you need to service of medical people. There is no way you can look at a person and ascertain they got pancreatic cancer. In the advanced cases, yes, it's going to be a lot of malnourishment. There could be a lot of jaundice, because sometimes when you have pancreatic problems, you're going to have also some liver problem. But without proper diagnosis, you will not know. So, and I think this is a big mistake that medical missionaries, herbalists are making. They're so anti-medical system that they are actually putting themselves at a big disadvantage. As long as the medical system can give us the proper diagnosis and monitor the condition. I am totally against practicing natural medicine. Practicing means you never come to the full knowledge of what you're doing. You're just practicing it like anything else. This is why I think you need to know what you're doing. You need to know the status of your patient. We found that out today. A lady was talking about somebody was a diabetic case, and they gave him something with 2 different patients. One patient died because they didn't know their blood sugar was too low. Without proper testing and diagnosis, you won't know, because disease could mimic many different signs. This is why you need to work with somebody as knowledgeable as our dear sister right here. And if I was sick, I would want to work with her because she would have a balanced approach being a medical doctor, could run the lab work and know what's happening in that lab work. And I know people now doing saliva tests, they're doing hair analysis. I don't have much confidence in that. I believe that the life of the flesh is in the blood. And I believe by doing blood analysis, we can get a pretty indication of what's wrong with a person.
Sir, I'm a cardiac patient. I want to know how to reduce heart blockages.
What was that? I didn't-
Can you say it again slowly, please?
I'm a cardiac patient.
You're a cardiac patient.
So I have got blockages.
You
so
have blocked
heart blockages here.
heart blockages. So,
Yeah.
okay.
So I want to know how to get rid of heart blockages.
He wants to know how to get rid of heart blockages.
Well, the first thing I would do, I would put you on the problem 95 to 100% raw diet. I would want to know how much is your heart blocked. Is it 45%, 90%, 70%?
Sir, I have not yet done, what do you call that? What do you call that? I just forgot. I have not checked.
Angiogram.
Angiogram, yeah, definitely. I have not yet done. My doctor doesn't allow me, not yet. I'm 41.
He's 41. He has not done an angiogram, so he does not know the extent of the blockage.
Okay, now, if you go up a flight of steps, do you feel out of breath or do you get some pain, some little small pains? So if you run, you don't have any problem. If you went running or jogging, you wouldn't have any problem. No problem.
When you went jogging, did you have shortness of breath? No.
If you have any swelling in your feet, no swelling. Well, I mean, how do you know you have blockage?
Last year, May, I went to CWM. My heartbeat was 90-100. My blood was thick. My cholesterol was 7 point something.
So he said his heartbeat was.
His cholesterol was very high. The
Yeah.
normal range.
Mm-hmm.
I was admitted in CWM CCU1 for 11 days. Last year, May.
Your cholesterol was real high. And what else was it?
He was admitted in the coronary care unit for 11 days, so he did have a heart problem.
Yes.
And they diagnosed you with a heart problem.
They just tell me that I got my heartbeat 90-100 and my cholesterol 7 point. Blood is thick. So they give me 5 tablets, 6.
Now, how's your heart rate now? Is it down?
I've not yet checked.
You don't know?
Yeah.
Do you know if you run a high pulse rate?
What's that, sir?
Is your heart rate still high? Is it still 100? Or is it gone lower?
A little bit lower.
So it's lower than 100?
I have no idea. I didn't
Okay,
check.
all right.
We need to check.
Yeah.
Yes.
See, what I'm getting at is that I work with a lot of people who have a heart rate 120, 140. That don't mean they got congested heart failure. And that don't mean they got a complete blockage. There may be some other factors why that could happen. You may have a blockage. I don't know, but I'm just saying I would want a more conclusive evidence that you got a blockage. And if I was you, I would seek out some medical attention to find out what side of my heart is blocked, what percentage is blocked, so you know what you're dealing with. Anytime if your heart rate go up real high, over 100, just take your ice pack, place it on your heart, and that will bring your heart rate down. And then seek a medical help. We deal with emergencies like that almost every week, where a patient come in with a heart rate 140, and they're out of breath, they're totally exhausted. Because around that, it's just like you running as fast as you can without resting. Put that ice pack on their heart, get them a little cayenne pepper, a little hawthorn berries, and their heart rate will calm down, and they feel fine. And then another thing that can cause you to have a high heart rate is your bowels. If your bowels are irregular, or if you're constipated, or if you're having a lot of diarrhea or loose bowel movements, your potassium level could drop. If your potassium level go down, that could influence your heart. So I'm saying these are the things that I'm trying to encourage people to work from a medical perspective, to know what you're dealing with, talk with some people knowledgeable that can help you. It could be a simple thing as your potassium could be too low.
So if we don't have
hawthorn
hawthorn berries is a very good herb for the heart. What is the substitute can we use here in Fiji?
Wow, it's the best in the world. I can tell you that right now. It's nothing going to replace hawthorn berries because it's a special herb for congestion of the heart. Now, the pine needles on the pine tree is for pulmonary condition. It's where you got lung and heart problem. So you take about a fistful of pine needles. You know what that is? The leaves on a pine tree. And they're growing all around here. Take those and wash them real good. Boil it for about 10 minutes in a quart of water. Strain it. Put a little cayenne pepper in it and sip on that. And that is really good for your lungs, for pulmonary and heart condition. So just sip on that, and that will help you a lot with that. I would go on an oil-free diet if I suspected my cholesterol was high. I would want to know if my triglycerides are high, because not just your cholesterol, you need to know also is your triglycerides are high. And if it is, I want to eliminate all fats and all sweets, because fats and sweets together are going to raise your triglycerides. And so I would go on an oil-free diet until I get my health together. I'd regulate my bowels, and that's what I would do.
Would you suggest grapefruit
I would definitely
for the cholesterol?
And I'm so glad you brought that out about the grapefruit. There's a thing called chelation therapy. Maybe some of you have heard of chelation therapy. It's quite expensive to get chelation therapy. Naturopaths can give it to you that would dissolve the plaque in your arteries so you don't have to get a bypass. It's quite effective. They developed this technique way back in the 30s, and it's really good, but it's real expensive. You may need 30 treatments to totally clean out your whole cardiovascular system. But as Margret was reminding me, that grapefruit is a natural chelation therapy. If you're not on high blood pressure medicine, you can use this treatment. If you're on high blood pressure medicine, please do not take this treatment, because the grapefruit will have an effect on your high blood pressure medicine. But if you would eat 2 to 3 grapefruits a day for 60 days, it would clean out your arteries. It would break down the plaque. Now, I'm going to give you an example for some of you so you can understand what I'm talking about. They have a commercial on TV, if you watch TV, where they have this big greasy pot with all this grease in it, and they will stick it down in the water, the soap and water, and they take it right out, and half of it is clean. Maybe some of you have seen that. And they're promoting their dishwashing. It is the citric acid in the soap detergent that you can put that greasy pot in the water. You don't have to rub it and take it right out, and it emulsifies the fat right off the pot. That is citric acids. So you can take the same citric acid in the grapefruit, drink that, eat the grapefruit, and it would emulsify the fat in your arteries, because it works like chelation therapy. But please don't eat the grapefruit or drink grapefruit juice if you're on high blood pressure medicine. Well, you need to check with your doctor to make sure that this grapefruit will not be counterproductive to your medicine. Because there are other medicine that grapefruit can interfere with.
My question is, what if you are not taking the medication? Can you take the grapefruit?
Yes, that's when you need to take it to clean out your arteries.
There are some high blood pressure medicines where grapefruit interacts with the work of the high blood pressure medication. So they would say, please do not take grapefruit when you're taking this medication. Chelation treatment is a type of a drip where they have minerals in the drip, and you have the drip for about 1.5 hours. It's about 150 New Zealand dollars. You would have it in New Zealand, or there's a clinic in Nandi that has it, Dr. Zanlow's clinic. You would need about 30 treatments. So it's the other alternative to a bypass to cleaning the blocked artery. So you have a blockage. The chelation, what the chelation does, it goes in and it cleans up these blood vessels. So the other way you could do it is if you're having a blocked blood vessel in your brain or in your heart or whichever part of your body, the other way to do it is eating 2 to 3 grapefruits a day for 60 days, like how Brother Mammon has explained. I hope that's clear. So where can you find grapefruits in Fiji? I've seen it in the supermarket, in New World, or in MH's, where you can find this grapefruit. It may be hard to find it locally. You have imported grapefruits, but we have some grapefruit. Auntie Luli is here. She knows where to source you some grapefruits from Wainimbokasi area for. We would get it from her for free. Auntie Luli, thank you.
Dr. Musudole, I'm sorry, I'm not getting it. Is it grapefruit or grapefruit fruit?
It's grapefruit. It's a type of, it's a large looking lemon. Very juicy.
So I'll spell it as G-R-E-Y?
G-R-A-P-E.
Grape.
Fruit. Grape fruit.
Grape.
Grape.
Okay.
Like grapes without the S.
Oh, okay. Thank you.
Sir, but I am not taking tablets. I am taking metoprolol, Anapril, aspirin, atorvastatin, and these are the tablets I take. But I'm not taking, I'm taking herbal medicine like garlics and apple cider vinegar, and I'm taking canned pepper, and I'm praying for it.
So the medicine that you are on would be contraindicated with the use of grapefruit. You can't use grapefruit with your medication.
Yeah.
So the best option for you is to make sure you go on a high raw diet with your medication that would help reverse your condition with the other herbs that you're taking.
And also I'm taking aspirin,
Yes.
the little white one.
Yes. So no grapefruit for you, sorry.
Oh, okay. Thank you. God bless you.
Now, there's one thing you can take. You can mix ginger, garlic, and onion together. And you can mix them in a combination of 3. Ginger, garlic, and onion. And that can help clean out your arteries. It's not as strong as the grapefruit, but it would probably be the closest thing you could do and still be within safety.
We'll take a last question. Our time is up.
Dr. Loata, ko nga nataro ko ko namate ko tukun chikaya. Oy ko namate nga ko yo tukuna chikaya. Ube kilangan na tapatali ko tukuna meda ken steam ba ko na kuwi na white
Flower oil. White flower oil.
Oy white flower oil ayana.
We'll take a last question before we wrap up for this evening.
I've got a problem on the knee. I've got a pain on the knee. And is there any help that can cure the problem?
She's got knee pain.
Mm-hmm. Well, there's a number of things, and I know Margret she worked with a lot of knee pain, so I'll let her comment on it.
Well, do you know what your knee pain coming from? Do you have arthritis? No. Well, we used to make up a salve for knee pain. And we use coconut oil. We put peppermint, cayenne, and DMSO. Did I leave anything out?
That's good.
Okay. And you make a rub, and you rub it on your knee. You can rub that on your knee for knee pain.
One of the things we've found with people with knee problem, if it's not from a physical injury, is that sometimes we are carrying too much weight on our joints, and that can be a problem. So you might have to reduce some weight. And I'm not looking at you, so you look fine from sitting here, but I'm just talking in general. If you're carrying too much weight, that can put too much weight on your knees. So by reducing the weight can help. Also, a cabbage leaf poultice. Pound about 4 leaves of cabbage and lay that on the top of your knee and sleep with that at night. That can be quite, helpful in reducing some of that pain. The main thing you want to find out, if you've worn out the collagen in your kneecap, I don't know. I mean, if it's bone upon bone, then you're going to have to apply some comfort poultice to help try to rebuild that knee collagen back. If everything else failed and it don't seem like nothing else is working, I have one sure remedy that will work. But you got to be tough to be able to stand it. If you're not a diabetic, then, you're tough enough. I'm sure you probably have you ever had a baby? Or are you tough enough? Okay, all right. And if you're not a diabetic, now if you're a diabetic, don't do this treatment. Take 1 bulb of garlic and chop it up. Put it in the blender, enough water to make a thick cream out of it. It can't be wet, it's got to be thick, like pudding. Smear that out on a white piece of cloth. Put that on the top of your kneecap. Don't put it on the side, do not put it on the back. Right on the top of your kneecap. Wrap that over your kneecap. And then just grit your teeth. In about an hour or 2, it's going to start burning you like somebody stuck you with a hot piece of fire. If you can stand it for 4 to 6 hours, 4 or 6 hours, big blisters will develop on your kneecap. It's going to look bad, but don't worry about that. As long as you don't rub those blisters, they will go away and won't even leave a scar. Take a sterilized needle and prick those blisters. Just put holes in it and let all of that fluid run out. As that fluid come out, it's pulling that inflammation out. We know this works because we know that when there's an injury, your body automatically builds fluid to contain the inflammation so that it won't spread in other places. That's a natural process. Swelling is a natural process to contain the inflammation. That's why whenever you spring your feet, it swells. Whenever you get injured, you swell. That is your body saying, let's contain the inflammation so it won't go anywhere. So by that garlic, it will pull that inflammation out, and then your knee pain will be gone. But please do not do this treatment if you're diabetic, and do not rub it when the blisters come up, because then it's going to leave a scar on your knee.
Sabina ka sa may dabo ng tangguna na kabinikwa. Damarota ka tangguna ni taro. Keso ay seberida na grapefruit. Tatawala ni mata kando ndo chikuwa. No tawala ndo do buna ti kumibala ke bagaro ni ko tamendo mendarida eh. Ba matiri ngono rongo na grapefruit e bidi extra ng bakasa. Angay ko to boli motay na usangay rida na grapefruit. Ko ba kachi ko na moli taiti ko ndo tani bula gay mamar na kulina. Ni o dibita bango na lewe na baka wiser tunga bali baka tu na multi uno binaka kalibwe sabi na kasama itini nanda ngono na kabini kuwa nda nangay bitar tartale na singalu tulebu na zakatale na ngoni taro na singalu tulebu o ker nda besureti mai na matanggali bitar tarong ibango nda sanga so ni ndando usutawa baka wasuma kini karua kunyando mandua na taro betali yang anio sakila sio senga nikila taro batana ronyo bakong bula iko oli bakong bula indua ito bimati anda bakong binak talalebu. Thank you brother Mammon, sister Margret, akin na bebuni Loata binak talalebu mdongona. Thanks for your time, may God bless you. We'll continue on Thursday night same pen barulangan da besukaki kremendo na damaso. Let's have a word of prayer. Father in heaven, we thank you once again for this wonderful opportunity that we can talk over issues about our body which you have created in your own hands. Thank you, dear Lord, for the knowledge and the wisdom that you have given your anointed, that you can share with us how to keep your temple clean and holy. Binakapagalebu turangan nung niloloma, nakapagalebu na vitalano na makabini kuwa, kimami bakalesyo bikimuni na baka binibinaka turanga, binakapagalebu na buku na yalomatua, binakapagalebu na nganggaw ni sulebi kimami ni kuwa, binakapagalebu na tombula na daw ni bingarabi, nakapagalebu ni mamimbula na kabini kuwa, baro may kimami bisukayaki, wasko kimami na nomo niloloma, wakot kimami talamay na singin ni mataka, may adano nomo nilawa, kimami maso na bakararabi, kunasakan na lube mo ni Chisu na ni mami bakong bula. Amen.